My anesthesiologist used to get furious at me. Don't tell these other people that you're doing this. Why are you doing this? And I knew that it would be good. First of all, I knew that men need to have it done correctly.
Yeah.
Also, I wanted to be the leader. I know someone would get out there and start talking about it. I want to be me. I want to be Moses.
Hello, Tom Levecchia here with the latest edition of the New Theory Podcast. This has been a few years coming. Dr. Steinbrech is joining us today. He is the leader in men's aesthetic male plastic surgery. Just came in from Manhattan after a busy day of surgery. Dr. Steinbrech, how are you doing today?
Doing all right. Early rise. We start surgery at 6, so it was a good morning and a good afternoon.
So we're going to talk about something a little different we don't talk about on my podcast. You talk about this all the time, is more men are getting plastic surgery than ever.
Yeah.
Let's first jump in. What type of procedures are men getting?
Really, it's everything, but it's a lot of face and a lot of body. You know, it's the kind of thing where men weren't talking about surgery. They weren't thinking about surgery. They weren't seeing it. They were sort of in their own little silos. And it's just been explosive because of a couple different things. Changing the ideas about what it is to be a man. And also the real kicker is social media. Everyone's watching everyone get older. Everyone's seeing everyone day to day. And they're staying competitive with the guys that they went to high school with, and they want to stay good looking. It's not just, they want to stay young. It's not just when they're up for their 25th class reunion. And they're also competitive for their jobs.
Interesting. So men get many different types of procedures, right? So we're going to start off with, and I know the comments are going to be coming below about me, but hair, right? Yeah. The old days, you took a big, huge swath of hair and moved it around and did all this crazy stuff. But there's a procedure that you do often called FUE, right? And you take a little bit from here and put it there. Walk us through that. What is FUE?
Yeah, FUE is follicular unit extraction. Okay. So the old ways to do a transplant was to take a big patch, they called it a strip, of hair in the back, and then take that out and then dice it up to small little follicles, independent ones, individual ones, and then transplant those in the desired area. Yeah. But things have gotten a little bit more sophisticated now with technology. Computers or robots can pinpoint a single hair in the entire patch. So instead of taking off a single strip and leaving off a big scar, sometimes it can be hypertrophic or keloid. Yeah. It just takes out one little bits of hairs all the way around. So it's like going in a football field and taking out a few blades of grass, but all the way up and down the football field. You're just not going to really miss those blades of grass.
Oh, wow. So you don't have that whole strip action going on in the back.
No.
Wow.
So it's, and usually people that are getting the hair transplant, this is where the hair is strongest. Yeah. So those individual little blades of grass aren't being missed. But when you put them all in one place, the desired area, either the dome or up in the widow's peak, it makes a big difference.
Now, with the hair transplanted, they select which hairs. Does it get kind of put in and then grow like a chia pet, or is it already kind of there?
No, you have to put the entire follicle into the scalp, so it's a complete transplant. Yeah. And then we wait for it because the hair goes through a dormant phase. Yeah. Where actually the hair that was in that follicle falls out. And then anywhere from 4 to 6 months, you have a dormant period of time, and then the follicle comes alive and the hair starts growing back.
Wow. Forever, essentially?
Yeah. Yep.
Interesting. That I did not know.
It's good stuff.
So men are getting hair. That's kind of like been the go-to for a while. And now there's new technology, which is pretty cool. So I know you're seeing more of that now. So let's talk about liposuction. Now again, so guys watching, I know the comments are going to go crazy. Believe it or not, a lot of men not only get plastic surgery, but kind of like the myth is, oh, it's only gay men, right? Can you walk us through? Obviously, you don't ask the proclivity of people's sexuality when they come in.
Yeah.
But you do just see executives, dads, traditional kind of men coming in, and you're seeing more of them. So what are those guys getting? I hear they're getting a lot of liposuction and stuff around kind of the belly. And then you have a little bit of a patent procedure that you like to talk about, body banking. So first let's unpack the liposuction, and then let's roll into body banking.
Yeah, and it's really all men. And we at this point, like, we may find out, or they may tell us. We don't necessarily even explicitly ask them their sexual orientation. But these days, you know how it is. You can't even tell necessarily. So it's pretty much non-issue for us, because a lot of straight guys are coming in with their wives. Used to be the women, when I operated on women, the women would come in with their brothers or the husbands or the nephews, and then they would want to have surgery after their
Interesting.
The woman. Now it's flip-flopped,
Yeah.
and now the women may come in with their husband. But or it could be a gay guy and his boyfriend or his husband. So that to me is just a complete non-issue. It's for everyone and whoever wants it. The great thing is sometimes a lot of the straight guys thought there was an issue about it. Yeah. And now the straight guys are completely opening up. They're finally deciding they just want to do what makes them feel good, and it's okay for them to do that. And their wives even encourage them to do that. So they come in, and when you talk about liposuction, they want to look great, because so many more people on the internet are now showing their workouts or flexing in the gym. Yeah. In fact, if they don't, there's a joke, there's like a meme that if you didn't Instagram a flex in the locker room, then you didn't go to the gym, So it's so much of it is on Instagram, and people are feeling it. It's become the new normal. True. But the problem is there are a lot of different issues. Yeah. First, there's genetics. Yeah. So genetics can have an impact on how ripped you can get, how defined you can get. And then the second thing is really time. Yeah. Before you get married, before you're in a relationship, before you're spending time in that relationship and with work, you had more time. When everyone was in college or just had one job, they were spending a lot of time at the gym. Yeah. But when your life changes, spend more time with the family, you lose that time. And the other thing
and you get older.
You get older. Yeah. Your hormones change. Yep. Genetics are always a battle. Yeah. So these guys come in and they've been working, they've been spending time with their family, and they just don't have that time in the gym. And we can help them get through those areas. And it's also, like you said, when your hormones change, that's going to affect your ability. We all know people that when they're younger and when they're younger, they have the time and their genes. When you're younger, your hormones are so different that you can stay lean much more easily. You can put on muscle mass much more easily. And as you get older, that gets a little tougher. Sometimes you need a little help.
But okay, so give us a little bit about traditional liposuction. Yeah. And what's kind of was like the gold standard, if you will. And then walk us through your patented procedure, body banking, which is much different.
Yeah, well, this is it. It's all about the science. It's really just math. Yeah. And there's no fancy equations, and it's very simple. What goes in, what comes out. And with old-fashioned liposuction, we just used to suck out all the fat, throw it in a bucket. But there's a problem with it, because if you do that after surgery, you better either cut down by X amount of calories or increase your burn. Because if you don't, the same amount of food, the same calories that you were eating before surgery are now, they're not just going to pass through you because someone said that you had liposuction. No. Those carbs you have while you're watching Netflix, having that ice cream, they are going to find fat cells that are left behind. Usually it's visceral fat, inner outer thighs, undesired areas, and those areas are going to blossom. That's what we call rebound fat. I even have a name for it, catch fat, CATCH, compensatory adipotrophic cellular hypertrophy. It just means a bunch of fancy medical mumbo jumbo. Yeah. It just means cells in other areas that were not removed are now going to compensatorily enlarge from the extra carbs that you have post-operatively because you never cut it down after surgery.
Okay, so again, people get traditional liposuction, but now you do body banking. And when I hear of fat, and look down and see fat, when I hear and see fat and talk about fat, you think it's bad, but you've been talking about 10 years how fat can be good in this sense.
Yeah, it's not just good, it's great. And I'll tell you why, because we use it for two different reasons. Number one, we take it out and we can use it like clay. So an artist doesn't take clay from one area and throw it in a bucket.
Yeah.
He takes clay from one area, adds it to another area. So by doing that, by subtraction and addition, that artist can get a more aesthetic, a more athletic appearance. And I can do that with humans. I can do that with men. The dudes come in, we take out the fat from the bad areas and isolate the cells for structure and volume. And I can make wider shoulders, put it right into the muscle. Bigger chest, more upper inner cleavage, some traps that pop, put it in his glutes to make a really nice athletic glute. And the second reason why we do it is because if it's placed there, then it's less likely to come back as fat cells and large fat cells in other areas. So that's why body bank has been huge for us.
So you talk about different areas that you put it in, the fat, and we'll get into implants for a minute. I want to kind of separate the two. But so you kind of mentioned putting in different areas, but like I was joking around with you. They say 6-packs are made in the kitchen, and I say they're made by Dr. Steinbrech. So you can make a 6-pack.
Absolutely.
That's crazy. How does that work?
So what we do is first we etch out the abs. So where your abdominal, your linea alba, your semilinearis, those are the vertical transcriptions, and then you have your transverse inscriptions. And those are the areas that make the 6-pack. But there's sort of a layer of fat that's camouflaging it, you know, and a little bit of loose skin. So we tighten it up with energy and we really carve out those transcriptions. But maybe that doesn't even give you enough projection about I've got a plan for that.
Yeah.
I just take a little thread of those cells and I augment just a peak of each abdominal 6-pack. It gives it more projection. So not only are we making a relief by removing, we're adding up just a little bit on top to increase that peak. And it moves with you when you flex. It moves with you. It's got to move with your abs. And it's really great. It's been a game changer for my practice.
And not just that. So, you know, I'm kind of thinking out loud. A lot of guys go to the beach. They're worried about, you know, it's not a, you know, worried about scarring. But you have a procedure that does this ab procedure, and it's called Scarless abs.
Right.
Can you like just elaborate on that?
Yeah, and it's funny because I talk at a lot of conferences nationally. This year I'm going to Cartagena.
Nice.
Then I'm going to Greece, and then I got invited to go speak at in Vancouver. Then I have to go to Sydney. So I'm going. That's in the next 4 months. So I get invited a little bit to travel around and to speak. But it's funny. A lot of times, other people will be talking about, you know, abdominal sculpting and ab etching and this kind of stuff because people are starting to do this and to know this. But they'll make all these extra incisions, incisions right on the abdomen.
Yeah.
And a couple of cases have been really awkward because I give my talk and I use specially curved cannulas. Yeah. So you don't have to make the scars. All the scars are hidden. They're hidden either underneath your swimsuit, inside your belly button, or sometimes they even come just in the shadow of the nipple across. Yeah. So you have none of those. And I see on Instagram all the time, God bless, these super ripped guys. And you can tell, you can even see it in the path of the Instagram where they didn't have anything, but you can tell that they had their abs done because suddenly it almost looks ritualistic. The scars didn't heal quite well because maybe they have a different skin type that doesn't heal, that has a proclivity, a tendency to have poorly healing scars. But I tell the residents and I tell all the doctors when I speak around the world, you cannot ever, you never need to apologize about an incision that you do not make, right? Yeah. You know, you don't have to apologize because you didn't need to make that incision, so it's not going to scar. The patient's not going to have a problem with that at the beach or the pool. And you know, if you're a bodybuilder or if you're at the gym, Other guys, they're not stupid. They see it on Instagram. They can recognize that that's bad liposuction. So I go to these conferences and I preach to these people. And I say, please, with today's techniques and with our tools, there's no reason why you should be making those extra incisions. And you know what? The very next speaker stands up, starts giving his talk, and in the slides it shows, and in the film it shows those extra incisions they're making. And it's really embarrassing and awkward because I just got done telling people not to make those. So it's a little bit sheepish when they make the presentations.
All right. So regular guy watching this, wondering, different parts of their body they want to improve on, again, whether they're using body banking, fat transfer, or using implants, which we'll kind of get into now. Guys, you think of implants, think of breast implants typically on women, right?
Right.
But you're the leader, probably the biggest provider of implants in the country, if not the world. So where are guys getting implants? Let's start off first with the arms.
Yeah.
Biceps are implants a thing?
Yeah, bicep implants, tricep implants, either underneath the fascia or underneath the muscle.
Wow.
And they're especially great for guys that have not a lot of fat.
Yeah.
There's not enough to put it everywhere. And I have these guys that come in. Look, in New York, we have guys come in from Chelsea. They are ripped.
Yeah.
They have no fat on their body.
Yeah.
Sometimes they're, doing a little bit, they're enhanced.
Yeah.
So they're using things that are going to make them leaner. Same thing when I'm in my Beverly Hills practice, where the guys come in from, guess where? They're coming in from WeHo, they're coming in from West Hollywood, and these guys are ripped. They don't have any fat.
Yeah.
So for those people that don't have anything to bank, or even people that do, there's not enough to go around. We use the implants, and the biceps look fantastic. They add a nice base that makes your own, because it's still your muscle, but it's your muscle on top of the implant that makes the peaks higher, and it makes a squeeze better, and it just makes your arms that much thicker.
Okay, so just like women, men also might get pec implants. Mm-hmm. Tell us how that is similar and different from female breast implants.
Yeah. Pec implants are a little bit different because female implants are like that bag of goo.
Yeah.
Pec implants are semi-solid. So you think about them like a gummy bear candy.
Okay.
So in fact, if we really want to make sure it's contoured perfectly for the patient, I'll even trim. You can even cut in and custom carve them for the patient so that the patient has it really to be very specific for their own anatomy. It also is different than a breast implant, because I can put in all them transaxillary, which is through the axilla. So it's through an incision in the crease of your armpit. And a lot of times for breasts, the surgeons will go underneath the breast or through the areola. I can do them all underneath the armpit, in between the pec major and the pec minor. It makes a beautiful pec sandwich. Beautiful instant volume in the chest. Looks fantastic. But then we do another thing. Put a little bit, just tighten up the cleavage on top of the implant by putting a little icing on the cake. So that's body banking that gives me increased definition. So you can use fat
and implant. Okay.
Yeah, it's composite. Composite means doing both the base of the implant and the icing on the cake. And that does two things. Number one, I can get more cleavage than with just the implant. Implant gives me volume. The body bank on top gives me great cleavage. But also it blends in the implant to make it just blend seamlessly with your own natural anatomy. There are no funky step-offs. Sometimes I see really on Instagram some bad pec implants where it doesn't blend in with anatomy at all, and particularly if there's a flash of the camera, you can almost see the outline of the implant, and it just doesn't look realistic, and it doesn't look natural.
Okay, so we'll talk a little bit about implants, a little bit about body banking. So you were in a documentary, actually a few of them, but most recently Skin Deep with Alex Porro and Anthony Lally, great guys. And Alex lost 300 pounds?
Yeah, he lost a lot, almost 200 pounds.
Yeah, it's 200 pounds, sorry, 200 pounds.
Yeah.
And with kind of the advent of Ozempic and the like, semaglutides, people are dropping weight left and right. So one of the fastest growing parts of your practice is men coming in with literally just a blanket of loose skin. So you do a procedure, a 270, 360 torso tuck, which is, I believe, kind of a male version of a tummy tuck, correct?
Yeah.
Essentially.
Yeah, and we have the trademark on it. Yeah, it's patent.
So walk us through like the anatomy, the machinations, because that's a big.
Well,
surgery.
I was seeing, I was doing more and more men,
Yeah.
and I was seeing some really bad incisions for men. What I realized is these surgeons learn from their surgeons, their daddy surgeons, and then their granddaddy surgeons in the hospital in the 50s and then the 70s and then the 80s. And they were doing this old, outdated technique for body lifts for women. Women wearing those one-piece, high on the thigh, French cut sort of suits. So that's the only way they knew how to do it. And those were the only incisions they knew how to make. And so guess what? In men who wear low pants, low board shorts, maybe even a Speedo, they were giving these same incisions that they were giving to the women, and it was just not working. And so I started changing all that. I started making lower incisions. I started focusing on tucking the shirt into the pants, pulling up the pants, but tucking the shirt into the pants, and then getting rid of that muffin top that the dudes have. And I realized you can't just do it with liposuction. And people may say that you can do it with energy. You can't really get it done. You got to heal with steel. That means we have to get out the scalpels.
So you like cut an apron out of the skin, right?
Yeah. Yeah. There's an apron, but it's not, people think it's, people think that, oh, this can be so painful. It's not trimming out the skin. That's not the painful part. The liposuction that you're going to get anyway, that's more the pain comes from. And even that's not so bad. And we handle it, we control it with pain medicines. And people are usually surprised that the pain wasn't quite as much as they thought it was going to be.
Yeah. Now, kind of a myth, if you will, or misinformation is skin does regenerate. However, if you lose so much weight, some guys think it's going to tighten up on its own through exercise.
Yeah.
Walk us through why it just simply won't. If you lost 60, 80, 100, 120 pounds, diet and exercise are not going to help with the loose skin, and surgery might almost be necessary. Why is that?
It's because, to put it simply, the skin has been just stretched out. And a lot of times these guys even have stretch marks, like a bodybuilder will have stretch marks if he makes or even a teenager that has a growth spurt will have stretch marks along his back. Same thing, the skin just gets stretched out. We call it attenuation. It becomes stretched out. And it just not, a lot of people think you're going to shrink wrap, remove the fat, and you're going to shrink wrap that skin right back. Or they think, oh, that excess that's around my belly, that's just fat. And if I remove the fat, it'll bounce right back. In fact, a lot of times, a little bit of it is fat, but a lot of it is just excess skin that's been pushed out over the years. And when you suck out the fat, the skin's not going to jump back as much as you will. And you're going to think that we didn't get all the fat out. It wasn't.
Yeah.
It was a thick skin, particularly on your back, that's still there.
Interesting. So we talked a little bit about implants, body banking, loose skin. Talk a little bit about the neck up. You have another patented procedures amongst many on the male model makeover, where you actually use derma fillers, and using neurotoxin in male model makeover?
Yeah.
So neurotoxins male model makeover, where you sculpt out the jawline, make the face, the malar, or the chin, the cheek a little bigger. And what I learned from you is when you make the cheek and have a little bit of a convexity here, it makes you look 10 years younger for men, right? Mm-hmm. And for women, it also makes them look thinner. So right. So I listen to you once in a while.
Yeah.
So, but walk us through the male model makeover, nevertheless.
Yeah. So male model makeover does exactly that. Yeah. It creates a convexity of where the cheek comes out, and also we carve up the jawline. Yeah. So when guys are aging, they're when they're a teenager, their jawline continues to grow. So, but you stop kind of your height around, 18, 19? Yeah, but different parts of your facial structure continue to grow. And your jawline, your mandible continues to grow until you're really 28 years old. Yeah. You know what your 28th birthday is? Bingo, it starts to recede. So that's why guys look so great in their late 20s, which just coincides with the mating period, cuffing season.
Theoretically.
So, exactly. So it starts to recede because you lose bone mass. Everyone thinks when you get that saggy, baggy neck, it's just the sun. It's not, or aging. It's loss of your mandibular height and also your projection. But we've got the answer for you. I can just recreate that by injecting injectables underneath the skin that are going to give you the projection that you had when you were 28 years old, and also give you a higher cheekbone, a sharper structure. Then when we do that in combination with removing the fat, which we can talk about. Yeah. Everybody's got a little bit of fat, a little egg yolk there that we can remove. So that's what gives you. We call it the male model makeover, but you don't have to be a model to get it. It makes everybody look great. Nice. And it not only makes you look better, but because it's replacing the volume in your jawline that you had when you were 28, it actually makes you look younger. But you don't have to wait until you're 28. I have a lot of guys that have weak chins. They don't feel confident. They don't feel like they're where they are in life, either relationships with girls or with their homies, or with boyfriends. Yeah. They just don't feel where they are, and in their job, they don't feel like they're respected. They see another guy that got the promotion that should have been theirs because he's closing deals with a confidence, and that's what they want. These are the guys that come in for a male model makeover, and it's a game changer for their life. They start to become more confident, but they're perceived by others as being more confident. Yeah. People want to work with them. They develop better teams. Yeah. Their social life also improves. So it's a huge game changer for these people.
So staying on the face, there also, you mentioned chin may recede. Some men may opt to get a chin implant. And I remember reading about a study that men that I think were like over 6 feet and had a pronounced chin made up like 78% of CEOs or some crazy number. Yeah, it was like, so there's a correlation.
It's one of those Malcolm Gladwell kind of
exactly.
things, all the CEOs are over 6 foot. Yeah, it's really true. If you have more confident looking facial structure, people want to work with you. Yeah. They're more likely to trust your decisions and have faith in the direction that you're taking them. Absolutely. I hear it over and over again.
So how does a chin implant work? Can you walk us through that?
Sure. So for chin implants, they go underneath through a small incision. They also can go through the mouth inside. Okay. And then it's a small incision. And then the implant is made by silicone. And so it's bendable. So we can put it through a very small incision, put it directly on what we call the periosteum. That's the lining that's on top of the bone. Yeah. And so we put it on top of that and spread it out and then close everything on layers. Secure it into position. Looks beautiful. A nice projection. I can square it off, make it more masculine. If you have a dimple, you want to keep it, you can keep your dimple. If you want to fill it in, we can fill it in and have a strong bar. It's just whatever you want. But that can really, really make a huge difference. So we have a thing we call it triple play. Yeah. Triple play is chin implant, submental liposuction, or neck tight, which is radio frequency to tighten up the neck, and a buckle. Take out the fat from here, add the cheek from here, and then suck in the liposuction. That's our triple play for men, and that's not even doing a neck lift. We can get to that. That's not even doing a neck lift. That's not even moving skin.
Yeah.
That's just repositioning the tissues that you have. So people, as soon as they're in their 20s, they come in for that because they can see that that's not going to go away. So we take care of that earlier. Some people get it done when they're in the 40s or 50s.
Wow. I was on a podcast recently. I think of him all the time. His name is Matt Cox, and he was a criminal, and he got plastic surgery so he could evade the law.
Right.
It actually worked for a few years.
Yeah.
Have you ever had a request for somebody to get plastic surgery? Maybe you don't know the reason, but to look different completely?
Yeah. People wanted to look like a celebrity.
Okay, yeah.
I had a guy that wanted to look like Matt Damon. Or they want a different life, And we had one that wanted to look, you get this a lot.
Yeah.
Wants to look like a Ken doll.
Yeah.
So you see them. Yeah.
What's the craziest request that you got?
It wasn't interestingly. It wasn't for a man. It was for a woman.
Okay.
I got one of the guys at work got a request for an implant, a very large implant, so that she could look like she was 9 months pregnant. And I don't know what she was up to, but she wanted an implant, maybe to go back and get a man to marry her, or I don't know what.
But all the time?
I don't think it was for all the time. I think she needed for a very specific.
And then you just take it out later?
Yeah, I think so. Yeah, my staff never really got to the bottom of it, and we sort of said, no, we don't do that here.
Oh my god!
Particularly when we're doing men.
God, that's funny. Even Julian's laughing. All right, so let's talk about kind of the guy. Okay, so a lot of guys watching this, and we're gonna get some comments and. It's fine because you've been dealing with this for a while, but the truth that at the end of the day, a lot of guys are requesting this from all different walks of life. But you put together kind of a 5 archetype type dudes that are getting this. Can you walk us through those?
Yeah. So they're just fine. This is one thing, and I think
I don't know if I
I don't think that this is being chauvinistic, but women tend not to be put into cubbies.
Yeah.
They don't want to be, classified in certain boxed in. Men have no problem with it. They're like, yeah, I know who I am. I'm that kind of type, and let's just call it that, so that I can move on with my life and work more effectively. So it's just differences between women and men. It's no big deal. So we've divided the website into the iconotype that you are. So it starts out with sort of the male model or the male actor.
Yeah.
In New York, it's more models, and in LA, it's more actors. But it can be anybody. It can be anybody. Maybe you don't necessarily even look like a model, but you want to look closer to one. So that's mostly facial work and working on your abs. And then the next iconotype is the regular dad, the next door daddy, the dad next door, and that guy, was working. Had a great body and was in good shape, but then he got married and was working on a job and sort of lost it. So that guy just wants to get back in shape, wants to get the fat out of his love.
Makes family a priority, maybe over working out.
Exactly, and he wants to get back into it and feel good about himself. Then the third one is going to be the CEO. So the CEO is a little bit older, and he wants to look good. And he's got to be competitive in the boardroom because the younger guys, all the tech guys are coming in and they're bulldozing through things, with their hoodies. So he wants to be still competitive. So for these guys, we're doing an eye lift, we're doing a neck lift. We're giving him advice with hormones. He may even want some help, and we can talk about this, with things in down below his belt. Yeah. And we use injectables, and we have a procedure that I can talk about that enhances your manhood. So that's our Forbes guy. That's our business CEO. And the next one over is a bodybuilder. So the bodybuilder is like totally in great shape, but there are one or two things that are missing. Maybe he got a little gyno from doing some steroids, a couple rounds of steroids. They all do it.
Gynecomastia, male breasts.
Yeah, which is chest tissue that's underneath the nipple, puffy nipples. So we do a lot of that. But then there are other things. There are like maybe areas that just aren't matching up. He may look great in terms of his chest, but his biceps are behind, so we can help with the biceps. So the biceps are great, but the chest is behind. Or he just can't get rid of this stubborn fat around his waist. So that's the fourth iconotype. And then we had it with Ozempic and with all the massive weight loss. And with the stomach stapling, we had the biggest winners. So that's kind of a take on the biggest loser because we think that these guys are winners. So this is massive weight loss. So which is huge for my practice in the last 5 years, when the men's stuff's been going on for 13, 14 years now. So with Ozempic and everything else, it's 270 torso tucks, 360 torso tucks, tucking the shirt into the pants and removing all that excess fat, and then getting these guys back to the gym where they're just continuing to move forward.
All right. Without getting demonetized, let's talk about the penile options. So a lot of guys come in and they want a bigger, like, kind of girth or circumference. And surprisingly, it can be done easily, and it's very non-invasive. You can kind of walk through a guy who's looking for, I guess, bigger girth.
Yeah. So in fact, that's what I call it, the girth procedure, which is, it's ready for this, GIRTH, gains in radius, so the girth, through hyaluronic acid. And that's what that is fillers. That's the goop that's in the syringes, very simply. So you may be, on the small side, or you may just be very generous, but you just want to be that much more on top of your game. So I can increase the girth, and we can do it in 10 to 15 minutes. You come in, we talk, we look at you, and we make a plan. And the plan is to increase the girth with injectables in a sterile way, safely. But the nice thing about it is I do it in a special way. So what I do is, sometimes people are afraid of getting sort of lumps or globs, things like that. Well, we do it in a special way. We dilute it a little bit with some saline and make it really creamy. So it goes in so it's nice and easy and smooth, so you have fewer problems and you don't have to worry about it so much. And the nice thing also about the saline is you can add essentially 3 times the amount of volume to see what direction you'll be going into when you add more volume the next time. So there isn't that fear of just like going in, having a bunch of concentrated product by someone that's not as experienced, who may leave it sort of lumpy and bumpy, and you spend the money, and you just want to make sure that it's being done right. And it helps us to make sure that we can do that.
How long does it last?
The company that makes the product, they'll tell us 2.5 years. We usually say about 1.5 years. Some people come in 6 months or maybe a year, and they just want to increase it or stay up. But definitely over 1.5 years for 90% of people.
Well, I was just asking for a friend. That's all.
Yeah, I know.
And for Julian. No.
Exactly.
So with that said, you gave us a lot of information on kind of the different procedures, options, who's getting it. So you've been like giving a lot of robust offerings when it comes to that. But there's kind of another side to this story, and people that watch this podcast expect, learning with the business end of things.
Yeah.
Just kind of stepping back from the macro view, from the bleacher seats, if you will. You went after 10 years ago and said, I'm going to go ahead and go after 9% of the market or 12% of the market versus the other 80 or 90%, which would be crazy from any business perspective. But then also, while everybody was going right, doing boobs and BBL butts and all bunch of other kind of stuff, you went left. And not only did it pay off, but it paid off in spades. You now have offices on New York Upper East Side, Beverly Hills, Los Angeles, and then Chicago Miracle Mile. So you made a pretty big bet, and you won, and you're winning. However, it wasn't always the case. So give us kind of like the bet you made, why you did it, and then when did you know you got it right?
Yeah, I started seeing more and more men, and we realized that there was something to it, but we needed to educate people. So way back in 2014, we made our first
13,
website.
I think, actually.
Yeah, I think even earlier. Yeah. We made our first website just for men, and it went viral. Yep. So that's when we cut and pasted it, and actually we ended up taking out the New York buildings and putting up the buildings from LA and the palm trees and the palm trees, and then we went right to LA and just started doing cases there, and then we moved to Chicago. So it was because I always say there are probably 2,300 surgeons specializing in women. Yeah. And how many people were specializing on men? Yeah. One. So if you do business and you understand the rules of supply and demand, which is the first thing you learn in econ, it's like day number one. Then you understand. And I read this book, and the book was called Blue Ocean.
Absolutely.
And they had a couple examples. One was like Yellowtail. Another one was Cirque du Soleil. And it was about finding that blue ocean where everyone was a bunch of sharks in the red, it's in the bloody waters, fighting for the same thing. Yeah. And the guy who went out to the blue ocean, the shark that went out there, he didn't even have to get any blood because it was all with a different price point.
That's right.
Doing a different thing, he could make things happen with a different market. And so I felt confident we could do it. But it wasn't easy. I just didn't switch the lights. Yeah. We wrote a textbook. Yeah. I edited a textbook with 46 chapters and 68 authors from all around the world, the best in aesthetic plastic surgery. Yep. A lot of articles, so a lot of research on techniques and with our company and developing techniques for men's plastic surgery. So this wasn't just making just a new website. It was, I had to establish credibility. And I think the textbook really had a lot to do with that.
So, funny story. So, when the website launched, and I want to say 13 for New York. Yeah. And at the time, and I don't even know if it's still around anymore, but Jezebel was kind of one of those kind of mocking, roasty kind of sites.
That's been gone for a while.
And that's when Gawker was around. They were kind of along the same thread, and that got jammed up by Hulk Hogan. But I remember when they did kind of an expose on your site. It was like kind of the new thing for manly men, and it kind of like dogged the site a little bit, and it showed some before and afters. And in the comments, like the site was like getting eviscerated. I remember to the point, and the article's still up, but like there was like 2,500 comments to the point they had to like shut down the comments and like re-upload because it like kind of crashed their servers and stuff. And we had access, because I work with Dr. Steinbrech, but we had access to the back end. So what we noticed was on the front end, the brand was getting eviscerated. I remember you and I were like kind of freaking out, right? We know all good PR is good PR, but we're like, wait a sec, this might not be good. But then we looked at the data, and the data showed that even though all these people front-facing were saying, oh, this is stupid, who would do this, blah, blah, on the back end, guys were spending an average of 16 minutes on the site in the thousands. Yeah. Not like a few, but thousands of men were spending 60 minutes on the site versus any given site. You're spending no more, if you're lucky, a minute and a half. So they were spending 10x on the site on the back end in the comfort of their own home with nobody knowing. But on the front end, oh, that's stupid. Who would ever do that? That's when I knew you had something. Yeah. Because it was like, don't do as I do. What is it? Don't do
as I say. Don't do as I do as I say.
Exactly. Yeah. Where this was kind of the opposite, where people are like, look over there and diverting, but spending a lot of time on the gluteal augmentation page, on the ab page. So like for me, that's when I knew you got it right. When did you know you got it right?
When I was doing all these women and there you could hear crickets, I knew I was doing something wrong.
Yeah.
And I would go to work and I would just hit my head against the wall and there was a time where in New York there were 8 plastic surgeons. Now there are about plastic surgeons. There are probably about 350.
I was going to say.
So, but I knew that it took longer to build up a practice, but I was still frustrated because I wanted it more quickly but when I started doing the men and I started looking at the numbers of the people, and I don't mean revenue, I'm talking about the numbers of people and the numbers of cases that I was starting to book on the schedule and how far I was booking out, I sat at my desk and I started crying.
Ooh.
But there were tears of joy.
Yeah.
Because I was really afraid that I wasn't going to make it. I mean,
That's
really
crazy.
Make it in the way that I had wanted to as a surgeon. It's not about, being rich or anything like that. That's not what this is about. It was really about being known for what I do and having people want and use our services. And there was one day I looked at it and everything changed. Suddenly I saw the calendar starting to really book out.
Yeah.
And I was like, this is it.
Yeah.
It's going to be okay.
That's awesome.
My family's going to be okay.
That's awesome.
My career is going to be okay. My patients are going to be okay.
That's awesome.
And it was a great moment.
So the other thing is I get fascinated because, medicine, although it's medicine and science and clinical, it's also a $16 billion a year industry in aesthetic medicine or plastic surgery, $16 billion a year industry. But you, rather than kind of sit in the ivory tower and just collect money, you not only speak about this, but you do teach your surgeons, other surgeons, about your procedures. You're open about it. You do a lot to show other doctors how to get involved in male plastic surgery. In the business world, that would make zero sense. Why do that in medicine?
Yeah, it's funny. This morning, before I started my case at 6:00 in the morning, I was calling another surgeon in Miami and calling him up. I'm not sure. I didn't get him. Maybe he was not up yet, or maybe he was in the OR. Who knows? But at 6 a.m., I was calling him to help him because he was asking me how to do abdominal implants, little implants for each ab. And my anesthesiologist used to get furious at me. Hi, Dr. Garland. How you doing, buddy? I love him. He's great. But he would get furious. Don't tell these other people that you're doing this. Why are you doing this? And I knew that it would be good. First of all, I knew that men need to have it done correctly. Yeah. And we just don't want to do it. Also, I wanted to be the leader. I know someone would get out there and start talking about it. I want to be me. I want to be Moses. I wanted to be the guy that they would see as starting this or starting more of it, popularizing it. And I figured also, even if more people are doing it, all ships rise to a higher level. Yeah. And I knew that would bring up, from a business standpoint, it would grow the market because more local people would be talking about it. But I know that they would still Google and try and figure out who's been doing this for the longest time, who wrote a textbook about it, who has the most men's before and afters in their galleries. Yeah. And that I knew it would be good for business in the end for our practice anyway, and that we could help more people. So I didn't have a problem with sharing it at all. And it has been good. We do get a lot. I get a lot of my patients from actually other surgeons that see me speak at other conferences, or they don't feel completely comfortable in doing it, or they just don't see enough men where they want to do it and they don't want to botch the guy. So they'll send them to one of our centers of excellence, either New York, Chicago, or LA. So that helps us help that patient get it done the right way, because it's not just me. It's my whole team. Yeah. It takes a village in this case. It takes a village, because you have to have the right staff that does a lot of these and knows how to do a 270 torso tuck. And it's to the point where I just put out my hand, and Unitas, my scrub tech, knows exactly what I want. Or out in LA, the LA staff knows exactly what I want. Or in Chicago, the Chicago staff knows exactly what I want. So they're all wonderful. And it takes this experienced team to be able to do that. And I think that's what we've created over the last, 18 years now. So it's been a nice ride.
Nice. So if you want to find out Dr. Steinbrech, you can find him on maleplasticsurgery.com. I'm going to put a link below. On Instagram, easy to remember, at maleplasticsurgery. And then maybe your personal account, Dr. Steinbrech?
Dr. Steinbrech, yeah, for Instagram. And so, yeah.
Nice. It's good, Dr. Steinbrech. Happy to have you on. I'll leave you with the closing words.
No, it's been great to be here, Tom. It's really been nice to
long overdue
have this in-depth conversation. I really enjoyed it. Thanks so much, man.
Thanks, Doc, for being
on.
on.
All right.